Welcome everyone. I hope you must stay safe and stay healthy. So let's start today's fact. Today we are talking about what should you expect from a hip MRI. Hip pain may require a test called magnetic resonance imaging. We called it MRI to diagnose the underlying cause of the discomfort. During a hip MRI, the patient is asked to lie very still in a tube, like stretcher, as the test is performed. A loud clanging noise may be heard throughout the test, as the magnets move to provide accurate imaging. The test is painless and completely non-invasive and usually takes between 30 and 60 minutes. An MRI machine is composed of three parts. The primary magnet is very large and is used to create the magnetic field necessary for the technology to work. Gradient magnets are smaller and allow the machine to focus on a specific body part. The coil is a part of the machine located nearest to a part of the body being tested. In this case, the hip. The parts work together to send radio waves through the body, creating a detailed image of the inside of the hip. Before an MRI, the patient will be asked to remove all metal jewelry and clothing. Any metal within the body must be reported to the technician performing the test, as some metals are incompatible with this exam. Patients with pacemarks or other internal devices may not undergo hip MRI. Watches, credit cards, and other items may be negatively affected by the image's magnetics and should not even be taken into the examination room. Patients will necessarily be asked to change into a hospital gown period to this procedure. A lab technician will assist the patient into an appropriate position on the examination table. Depending on the imaging lab, the MRI machine may be similar to a tunnel, or it may have two or more open sides. As the MRI begins, the patient must remain very still so that is resulting images are clear. When the magnets are working, the machine can be very loud. The sound is similar to a loud knocking or banging. Periodically during the test, the knocking may stop and resume. The technician administrating the exam should be available to the patient via microphone during the procedure. Sometimes patients have difficulty remain still for the 30 to 60 minutes required to complete the hip MRI. If this is the case, a doctor may provide medication to take prior to the test to assist in relaxation. If this is a concern, the doctor should be informed before scheduling the hip MRI so that the medication may be prescribed. A hip MRI is a painless procedure. It assists a doctors in diagnosing the causes of hip pain so that appropriate treatment may be provided. There is no special preparation for the procedure, and patients may return to normal activities immediately following the test. So that's all for today. Goodbye everyone. Have a good day ahead.